If you have pain when you're doing movements like this, or pain right here when you lift your arm up overhead, you may have shoulder impingement, and this is not something that you want to ignore. I'll show you what I have my patients do to loosen up that shoulder and get rid of their pain. So when you have shoulder impingement, there's a lot of muscles around the shoulder that get really tight and limit the movement or affect the movement at the shoulder joint. So what I'm going to show you today is how to address those muscles, which muscles are involved in this issue, and how to do that with your massage gun. So this is nearly impossible if you have to hold your massage gun because you just simply can't access some of these muscles. So I like to use the Sozo mount. If you don't have one of these, comment Sozo below and I'll shoot you the link. So the muscles we're going to want to address are the pec major, the pec minor, which runs right here, your anterior delt, your medial delt, the supraspinatus muscle at the top of the shoulder here, your rhomboids between the shoulder blades, and then your lats out here on the side. So there's quite a few muscles we're going to run through, but I'm going to show you quickly how you can address all of those. This is the pec major. When you're doing the pec major, you want to go from the center or the medial portion of the muscle and work your way out towards the shoulder. Next, we're going to do the pec minor. What you can also do while you're working on these muscles is incorporate some movement of the shoulder if that feels beneficial for you and you have the space to do so. Next, we're going to do the anterior delt. The next muscle we want to work on is the medial delt, so in the middle of the shoulder. Next muscle, posterior delt. Next muscle, supraspinatus at the top of the shoulder here. The next muscle is going to be the rhomboids, which run between the shoulder blades. The last muscle we're going to want to work is the lat muscle. These muscles significantly affect how the shoulder can move and how much range of motion you're going to have. It's also going to have a significant impact on the amount of pain that you feel if you're suffering with this condition. So testing before you do the muscle therapy with the massage gun, seeing how much range of motion you have, how intense the pain is, and then retesting after you do the therapies is beneficial to see how much this is helping. Frequency on this, you want to do 3 to 5 passes per muscle, and then you want to repeat that 3 times each time you do this. I would recommend doing that 2 to 3 times a day to start until you start seeing significant results in reducing that pain, and then you can start to reduce the frequency, doing that just before workouts or in the morning when you wake up. That'll really benefit you and help you get rid of this pain.